This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
Here we go, baby. The Berman Method podcast focused on treating problems and not symptoms. Your co-hostesses is Dr. Jake Berman here with
Jenny Berman, physician assistant.
and Walker Ryan Bermanator.
Walker Ryan sitting with us this morning.
Yeah, sitting tall, stable, a lot of trunk control starting to kick in.
Mm-hmm.
Head and neck are doing good.
Starting to eat some food.
Oatmeal. Peanut butter.
Peanut butter. He loves peanut butter.
Oh my goodness. Must be genetic.
Yeah, there probably is something to that. If you didn't listen to last week's episode with our other sidekicks, you definitely need to go back. Might be my favorite episode out of the 188 that we've recorded.
Yeah, that was a ton of fun. And it was kind of bittersweet this morning because usually we send Stella and Vera over to my mom's house while we podcast. And Stella goes, well, wait a minute. I'm podcasting with you this morning because I'm 5 and I know how to podcast now.
She said, I already did it last week and it was so good that I just know what I'm doing. And now I need to podcast with you every week. I already told Nia and Pop I'm not coming over because I'm podcasting now.
At 5. And I'm going, oh my goodness. She's not wrong.
We have a natural here.
So definitely go back and listen. It's short and sweet. And there are some really good, valuable things. I mean, just black and white from a 5-year-old.
Unprompted from a 5-year-old.
Unprompted, unsolicited, no training or prepping.
Didn't even tell her what questions we were asked. Before we recorded, Jake's like, are you at least going to tell her what you're going to ask her? And I was like, no. Let's see what she says.
Yeah, and she did awesome. So getting back on subject today, we're David going against Goliath, Goliath being the corporate medical system. And I was just in a continuing education course this past weekend, and it further cemented that we are on the right path where what we're doing is still so small as far as the general scheme of healthcare goes. I mean, it's got to be less than 5%. I'd even venture to guess it's probably less than 2%. Maybe even less than 1%. We should probably look it up. I don't know how we would look it up. Maybe we can use AI to ask the question, what percentage of Americans are seeking holistic healthcare? What percentage of Americans are going against traditional American Western medicine models, not for acute care, right? We're not talking about not acute set things like a heart attack or a stroke. Talking about chronic illness like diabetes. It's skyrocketing. The amount of insulin resistance is skyrocketing. Obesity, orthopedic surgeries. What was it? I just heard a stat just coming home from the East Coast, listening to Joe Rogan interviewing Gary Brecka, I believe it is.
Yeah, he does the 10X.
Yeah, Gary Brecka. And he states this statistic where America is leading in all the wrong categories. Number 1 for obesity. Number 1 for insulin resistance in the world.
It's nuts. I actually saw a post just recently where it was an AI, like somebody was asking AI questions, right? So it's AI. We have to give and take a little bit here. They asked ChatGPT AI what the average height and weight for a 38 to 40-year-old female in the United States. Average height, 5'3.5", average weight 170 to 175 pounds, putting them in the BMI from 30 to 40%, which is obese. So the average 38 to 40-year-old female is obese. with a BMI of 30 to 40%. Or I'm sorry, that was the body fat percentage was 35 to 40%. The BMI was between 29 and 30. And then they asked what percentage of women aged 35 to 55 are obese, and it's 42%. 42% of women between 35 to 55 are obese in the United States.
That is insane. It's absolutely insane. But again, hopefully we're not preaching, or obviously we are preaching to the choir here, but just wanted everybody to know that we're starting to make headway. It's starting to get more popular. We're trying to spread the word. All of you listeners out there are sharing these episodes with other people. We're starting to find people organically, and we've got to keep it going. And one of the other things that I wanted to do was kind of boast a little bit about Jenny and myself, about the hundreds of thousands of dollars that we're spending on our own continuing education to learn more. And I have to admit that I went the cheap way 2 years ago. So every 2 years, we have to get continuing education credits to renew our license as a physical therapist every 2 years. And 2 years ago, when it was time to renew my license, I admittedly went the cheap way. And when I say cheap, I'm talking mainly about investment in time and energy. And I did it all online. And it's the first time in my career where I didn't actually go to an in-person course, a weekend, 2-3 day in-person course. And I just did it online. And yeah, I got the credits for the hours and renewed my license, and I did it fine. But this past weekend, I went back to what I've been doing a lot of, which is the Institute of Physical Art. It's who I've been doing 95% of my continuing education through for the past 15 years. And the amount of energy that it required, the amount of brain power, the thought process, constructive or critical thinking, and really learning this new skill that I learned this past week. And it was all about the pelvis and the pelvic girdle. And it was just amazing how much effort it required, but how energized I was by the time I was leaving. And it just requires so much effort to do it that the vast majority of healthcare workers are not going to do it. Right?
Right. Yeah, for sure. They want to, now everything's can be done virtual. So they just want the easy route of doing it at home virtually, where they can sit at home on their own sofa, scroll social media, and not have to really pay attention and think. We don't have to actively perform what they're telling us. It's easy.
Yeah, it's the easy way versus what Jenny and I have been doing, again, boasting here, is spending ridiculous amounts of time and money on getting these higher level educations that really separates us from the vast majority of thought process. And there were a couple of people in my class this weekend that do come from traditional Western medicine, outpatient physical therapy clinics where you're just doing this cookie cutter approach. And it was very, very obvious when it came time to actual intervention where it's like, wait a minute, your hands are not doing anything they should be doing versus a skilled tradesman. The hands are kind of autonomous and they're just doing what they should be doing versus trying to figure it out at the same time. And it's further confirmation that you get what you pay for. Now, here's the best part of my weekend was, so we were in this outpatient surgery center, a room in an outpatient surgery center on the East Coast, and we had 8 high-low tables there. And when it was time to put everything away, the course was over, we had to go put the high-low tables, those are the tables that you lay on when getting treatment, back in the physical therapy room. So we're pushing them down this hallway and we go into this physical therapy room and we go in there and I'm going, oh my gosh, this place is huge, absolutely huge. There was 15 tables in there. It was an entire gym. There was all sorts of recumbent bikes. And I'm just going, oh my gosh, this place is a mill. It has to be an absolute mill where the physical therapists are treating 3 to 6 patients an hour. And they're just pointing, go over and do that now. Now go do this. And there is 0% chance that these patients are doing the exercises 100% correct 100% of the time. It's just not possible. It was an absolute mill. And it just gave me further confirmation that we're on the right path. You got to find the right solution for you. And the cookie cutter approach works great if you're sedentary and you're not in shape, because it takes you from doing nothing to something. But if you're like the vast majority of our listeners and you are physically active and you do live an active lifestyle, then it's not going to work.
Right, right. Well, and I think that's things that we've talked about several times on this podcast. And if you're new, thank you for joining us, and certainly go back and listen to some of our prior episodes as well. But you have to seek out the right provider for your body, and you have to do your research and know where is the education from your providers coming from, and is a provider that is seeing you for 10 minutes and putting their hands on you for 10 minutes and then sending you off with a trainer, with a tech, or to do exercises and machines and not actually watching you perform. Is that actually right for you versus someone who's with you one-on-one for an hour and can pay attention and do these specific modalities that you're learning on the weekends and spending money to be educated on?
Exactly. So the same thing is true in your field, where how many times over the past year have you had somebody interested in working with you, and then they find out the price tag and they're like, you know what? I'm going to go see the dietitian at the hospital.
Right, right.
And it's like, what? Like, we're not even in the same ballpark. We're not even close. We're selling Bentleys, Benzes, and Maseratis, and you're over on the used car sales, the used car lot, looking at a Camry that has 300,000 miles on it. Yeah, you can go to the hospital and have the dietitian work with you once a month. What's that like?
Right. And there's so many in town, in Naples at least. There's so many wellness coaches and nutritionists that got a certification online, and they're starting their own businesses and doing nutrition counseling. But then I have to think about, when I see all these all posts about them all, I have to think, well, what are they actually providing? What training did they get? Did they get their training online? Are they providing the opportunity for these patients and clients to check their blood work and actually know what's going on from the inside out? And that's one way, with us, me specifically in my practice, we have a whole team of providers everywhere from physician assistants like myself and my other PA that's in the practice, to registered dietitian, to a functional nutritionist. We have these elite certifications that allow us to dig deeper into the individual and not just focus on the food by itself. We have to look at the whole picture of how is the food being metabolized. And like you, I went on and have done I did a specialized certification for infertility because I found that I had a passion in that and helping individuals with that. And I know what worked for me. I know what's worked in other functional medicine practices, but I actually went for a 4-day certification, 10 hours a day, to learn more about functional fertility and become a certified fertility provider. And then from there, found this passion with the system that I was using. It's called A4M. And actually just did a year-long fellowship program to become an board certified anti-aging health practitioner. And that's finally officially official.
Congratulations on that. You officially have your official certification.
I do.
So you are official.
It is. But like you said, there were 5 modules within my fellowship, and the ones that I went in person were night and day different of actually obtaining the information and applying it and talking to the other health practitioners that were there and seeing what they're doing in their practice and learning from them and finding out about these new companies that I could be using to make my testing even better for our clients. And it's just amazing when you spend the time and the money. I mean, it's expensive to go on these in-person CME trips, but the quality of learning and being able to apply it to the patients is just immaculate, and the patients thrive off of it. So if you're seeking a place with functional medicine or physical therapy or even your doctor, you need to learn what are they doing to better their education for you, not just to get the credits on their renewal, but what are they doing that's actually going to help you as the patient, the client.
That is so important, absolutely crucial, because it's so easy to just find the bare minimum because life happens, right? We've got 3 kids.
Yeah.
Life is absolute chaos right now.
Especially as a PA, I need 100 hours of continuing education every 2 years. 100 hours. That's a lot of hours. If that's more than 2 weeks worth of
Full time.
Yeah.
Yeah.
More than 2 weeks full time of getting continuing education. So certainly it can be, with life being busy, you're like, okay, just go online, pay for these credits and get it done, versus actually going and learning and obtaining and applying.
Yes, it's tenfold, because think about it. Here's the most obvious thing coming from a post-COVID world. When we were having meetings on Zoom, 99.9% of us were multitasking.
Right.
You look like you're looking at a camera. You're not even wearing pants. You might have put a shirt on. You probably didn't even brush your teeth. And you're staring into the camera. But in reality, you've got 14 different browsers open, and you're emailing and you're checking Facebook and you're texting all at the same time. So you're hearing things, but you're really not hearing things or absorbing things. And that's exactly what my continuing education was 2 years ago when I went to go to renew my license. Was I found a course, and it was live, virtual, and I could just put the lecture on. And I remember doing yard work for a few hours. I'm out there mowing the grass, trimming trees. And okay, yeah, I got my hours. I renewed my license, but I was 0% better as a practitioner. I was doing 0 to improve the quality product when I did that. So it really felt nice to get back into the classroom this past weekend. Yes, it's a beautiful weekend that I gave up. So this was the conundrum, right? So boating is a major part of our life. Every Saturday that we're in Naples and the weather is conducive, we're on the boat. So I'm going back and forth for 3 months. Am I going to go to this, or am I going to find some virtual continuing education? And it was the week before. Jenny goes, "Did you sign up for that course or not?" And I'm like, "I'm waiting to see what the weather forecast looks like." And the weather forecast comes out, and I'm going, "Oh my gosh, it's going to be absolutely beautiful." Like one of those weekends that we could actually shoot down to the Keys for a quick trip down to the Keys and back. And I'm going, you know what? Screw it. Because there wasn't another opportunity between now and November when I had to renew my license for a class on this caliber. I could have found other classes, which I did find, that were going to be cookie cutter classes that I could have done. But this one was a very high level course, and there wasn't any more in between now and November. And I said, all right, screw it. There'll be another weekend. Let's commit the whole entire weekend and go learn something and do something much better than we possibly could do if I don't.
Right. And it also comes back to having a coach, right? Coming back to having someone teach you, guide you, hold you accountable, make you show them how you're doing it and correcting you, just like we do with our businesses. We've had a business coach. I was just telling a client this. She asked me, well, how long am I going to have to do this? I mean, at some point I should be able to figure this out and fly my wings. And I was like, I've had a business for 5 years and I still have a business coach. I'm still seeing this coach 8 times a year, and I've owned a business for 5 years. Like, you always will need a coach to help you move the needle. If you don't, you're just going to stay in the same spot. Like, great, you're doing it, but you're not getting any better.
Oh my goodness. We should probably bring this up at the beginning of the next episode, because I could talk for an hour on this. And I've been saying it a lot since we went to the Masters, because what did Scotty Scheffler do? Scotty Scheffler is the #1 golfer in the world. He's a prodigy. There's been nobody like Scotty Scheffler since Tiger Woods in the early 2000s. He's just winning. He's a machine. He's unstoppable. Absolutely unstoppable. He's #1 in the world. And at the Masters, he was not on his A game. So he finishes a round and he immediately goes to the driving range after the round. And his coach is right there coaching him until the sun goes down, like nonstop. And this is the number one golfer in the world. You would think if you're the number one golfer in the world, you don't need coaching anymore. You got it figured out. The reality is you don't.
Right.
You never do.
Whether it's mental, physical, emotional, things are always changing. There's always going to be curveballs coming in. You need somebody from the outside looking in to help you on the next step.
Love it.
So awesome.
That was fun. So go back and listen to last week's episode, share last week's episode. I can't wait. So we told Stella to listen to her episode when she's over at my mom's this morning. I can't wait to hear what she has to say when she comes back.
Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.